Welcome to The Explainer. You know, we've mapped the entire human genome. We can literally edit our DNA with tools like CRISPR. We've sent people to the moon and back. So you have to wonder, after decades of effort and literally billions of dollars in research, why are we still asking one of the toughest questions in all of medicine? Where is the cure for cancer?
And look, if you're a patient or you have a family member who's sick, this is probably the most reasonable question in the world to ask. It comes from a place of hope, of frustration, and just a basic belief in what science should be able to do. The search for an answer, well, that's one of the most important stories in modern medicine.
Okay, so let's really get into this. It turns out, the answer doesn't start with a new drug or some fancy technology. It actually starts by realizing that the way we've been framing the question, that's the core of the problem right there.
So let's start with the first big idea. When we say the word cancer, what are we actually talking about? Because the answer to that really is the key to everything else we're going to discuss.
To get our heads around this, let's try an analogy. Asking for the cure for cancer is a lot like asking for the cure for infection. I mean, an infection could be a virus, like the flu. It could be a bacterium, like strep throat, or it could be a fungus. You would never use the same medicine for all three of those, would you? Of course not. They're totally different problems that just happen to fall under the same big category.
And that is exactly what cancer is. It's not one disease. It's just the label we use for hundreds of biologically distinct diseases that all behave differently. Lung cancer is not breast cancer, and breast cancer is not leukemia. So a single universal cure is it's super unlikely because there isn't one universal thing to target. This isn't a failure of science. It's just the reality of biology.
All right, let's move on to the second crucial point. And honestly, this one can be even harder to wrap your head around. See, unlike a virus that comes from the outside, cancer has this unique and kind of treacherous origin story.
This is the absolute heart of the matter. Cancer isn't some foreign invader. It is literally made of your own cells that have, well, they've gone rogue. It is a betrayal from within, where your body's own machinery gets hijacked and turned against itself. So these are your own cells, but they've picked up mutations that let them do some pretty extraordinary things. They learn how to completely ignore the signals that tell them to stop growing. They figure out how to become invisible to the immune system that's supposed to find and destroy them. And they become absolute masters of adapting and surviving under pressure.
And this right here, this reveals the fundamental dilemma of every single cancer treatment out there. Because cancer cells look so much like our healthy cells, every therapy has to walk this incredibly fine line. You have to be lethal enough to kill the cancer, but gentle enough on the rest of the body to be survivable. That unavoidable trade-off, that's why side effects are such a basic, built-in part of cancer care.
Okay, so let's recap. We've got the cancer is actually many different diseases, and it's made from our own cells. But there's a third layer of complexity, one that makes it a really, really devious opponent.
And I mean that in the most literal biological sense. A tumor isn't just a static blob of identical cells. No way. It's a dynamic, living ecosystem. It changes over time, and it changes especially fast when you put it under the pressure of a treatment.
Think of it exactly like antibiotic resistance. You've probably heard about that, right? When we treat a tumor with a drug, we're applying this massive selective pressure. The drug works, it kills off all the vulnerable cells, but, and this is the key, if there are even a few cells that, just by chance, have a mutation that makes them resistant, they survive. And now, with all their competition gone, they're free to multiply and take over, creating a whole new tumor that the original drug can't touch.
Okay, so the logical next question is, hold on. With all our new targeted therapies that are designed to hit these very specific mutations, shouldn't we be able to solve this problem? It's a great question.
Well, the problem is that cancer cells aren't loyal to any single strategy. They are masters of finding workarounds. A targeted drug might successfully block one pathway they need to grow. We'll call it pathway A. But the cancer cell is smart enough to just activate pathway B to get the same job done. So these incredible drugs, they often give us a temporary advantage, but they're not always a permanent fix.
So, given all this complexity, all these challenges, how should we even think about progress? Well, it really requires a shift in our perspective. We have to move away from the idea of a single magic bullet cure and towards a different, but just as powerful idea.
First things first, it is so important to remember that we do cure many cancers, especially when we catch them early. When a cancer is just a localized lump, we can often remove it completely with surgery or just blast it with radiation. The game changes completely once it has spread. At that point, The disease is microscopic, it's widespread, and it's basically impossible to get every last cell. The difference between curable and incurable is so often just a matter of timing and biology.
This is a really crucial point to hold on to. When you're facing a challenge this huge, it can be easy to start wondering if cures are being hidden or something, but the truth is much simpler, and in a way, it's much more profound. The problem isn't some conspiracy. It's that we are fighting biology at its most complex, its most stubborn, and its most adaptable.
So, what does real progress look like then? It looks like turning a disease that used to be an immediate death sentence into a chronic, manageable condition. It's about adding months and then turning those months into years of good life. It's about developing new treatments that keep patients alive long enough for the next breakthrough to come along. Real progress is built layer by layer on these hard-won, partial successes.
So let's just pull it all together. Why is there no single cure for cancer? Because it's not a single thing. It's hundreds of different diseases. Because it's made from our very own cells, which makes it incredibly hard to target without collateral damage. Because it's genetically unstable, and maybe most importantly, because it's evolutionarily adaptive. It is constantly changing to survive whatever we can throw at it.
And this is really the final thought I want to leave you with. Maybe we've been asking the wrong question this whole time. Maybe the goal isn't to find that one magic bullet. The real and, frankly, the more inspiring challenge that thousands of brilliant researchers are tackling every single day is this one. How do we continue to outsmart, outmaneuver, and control the most complex, adaptive, and resilient opponent that biology has ever created? The answer to that question, that's where the future of cancer care really lies.